Hello, everyone. Welcome to the October 2025 edition of One Man's Meat is Another Man's Poison podcast. We'll continue our discussion on herbal medicines done right, the most effective preparation methods for maximum benefits from herbal preparations. Most people prepare herbal medicine in one form or the other, as teas, as decoctions, and so on. And they're very effective, but there are ways of preparing herbal medicines to get the maximum benefit from them. So I would like to discuss today herb interactions as it has to do with polyherbals. I see a lot of polyherbals circulating and people talking about their efficiency. So um, I decided to do this so that we're also better enlightened about some of these polyherbals and some of the herbs that they contain. So when you talk about polyherbals, these are herbal medicines that contain many or several different plant parts, like the leaves, bark, roots of different plants all together in one. So it's noticeable that some people have the mindset of the more the merrier in the use of herbal medicines, but this may not be the best in some instances. In some cases, the synergism helps, but in some instances, it may be causing harm. So this herb interaction can be positive when there is synergistic interaction. So the compounds in the herbs are combining, having an additive effect, making them very potent, more potent, and helping the patient. For instance, bitter leaf and basil leaves complement each other so well when they are prepared as antidiabetic tea. There is also antagonistic effect where the compounds in the different plants interact negatively and one does not get the complete and effective health effect. Example, morinda, not moringa, morinda tree leaves and bitter leaves, usually prepared for the treatment of malaria, do not go so well together. This combination reduces the efficacy of the medicine, and this happens because the chemical compounds in both plants interfere with their functions. They're not good together. So it's usually very good to use each of these plants alone because on their own, morinda leaves has very potent anti-malaria principles and the same with bitter leaves. Now, going on to the synergy that could also become negative is when it promotes too much of a good effect. Example, combining moringa this time, moringa leaves, which is very popular, and bitter leaves. Both have strong hypoglycemic effects, meaning that they reduce blood sugar. So when they are combined, it makes the effect very powerful and can lead to very low blood sugar, leading to dizziness, hypoglycemia, serious hypoglycemia. So this also happens when bitter leaf is combined with neem as a director, that's dogoyaro as we call it here. So another negative interaction is basil leaves and cloves. Both have powerful antimicrobial and anti-inflammatory medicinal properties, but recent research has found out that taken together can lead to stomach irritation. So, and the person may not even attribute it to the medicine that he or she is taking. So there's so many more examples on this. Please keep commenting, asking questions, subscribing. Next month, November, we'll be discussing herb food interactions, which I have spoken about briefly in the past, but now I will delve more into it because I'm hearing some feedback about certain examples, the common food, common herbs that people take. Thank you so much for listening. Ciao.